let me go to the next question, the fourth question which I have, and that is something which most of the doctors are going through. What happens is now we at Sancheti Hospital have a COVID ward. Many people are in their own hospital admitting COVID patients because there's overwhelming number of patients. Some are directly involved, some are indirectly involved. And every day, Sister Shivani, all of us, all doctors get calls that we want a bed, we want a ventilator, we want an oxygen bed. And the feeling which I echo of helplessness, help, despair is a common feeling which most of us have experienced in the last 3 weeks, which probably in the last 30 years we have never faced. In these last 3 weeks, collectively, to say no, a patient is in an ambulance, his oxygen cylinder is getting over, and he calls you, Dr. Parag, what do I do? Where do I go? I know that there is oxygen supply. Our hospital is on the last cylinder. Ventilators, all of them are booked. And, so it's very difficult. And this is something which every day in our meetings, when I talk to my friends or doctor colleagues, this is a common thing which is going on, a feeling of despair, feeling of helplessness, which eats us. That's a negative affirmation in your language.
Yes,
So
yes.
I really don't know how to handle this and how to come about this feeling of despair and helplessness. Can you help us, sister?
This is something which a lot of us are going through. Of course, doctors and hospital people get the maximum calls, but a lot of other people also get calls. Can you help me? Can you connect me to this one? Can you get me? Now, okay, the situation is not easy. Again, the pressure is very high, the numerator, right? It's not at all easy to say no to somebody when you know what the outcome of that no will be. Because as a doctor, you can already see the outcome, that if this person does not get a bed within 6 hours or within 24 hours, you are already able to visualize the outcome of your no. So when you say a no and when you see the outcome of your no, it becomes a huge moral responsibility. It becomes a huge karma. And somewhere we start holding ourselves responsible when something might not go right, when that person probably might not that day get a bed in any hospital, and then we know what can happen. And somewhere that will get recorded on our mind saying, I, directly or indirectly, have been a part of what has happened today. Now, now just let's pause. If we look at it like this, yes, we will feel we were a part of it. Now we have to look at it spiritually. Now, this is where spiritual principles are very important. First thought, I am going beyond my capacity to help. Is my conscience clear? Yes, my conscience is clear. I have to keep my conscience clear, which means my karma has to be accurate. Am I being careless? Not at all. Am I being laid back? Not at all. Am I stretching my boundaries completely? Totally. Totally. Is my conscience clean? Highest level of cleanliness that this time, that we are doing everything our best. Was my karma right? Absolutely, it was right. Could have I accommodated them? Didn't have place at all. Did I make a mistake deliberately? Not at all. Talk to your mind. You are going to question your karma. Nobody else is going to question you. So be very, very authentic inside that I stretched my limits and I did everything. Second, after that, now please take this in the right perspective. Please understand, we can help people, we can treat people, but we don't write the destiny of people.
Right,
Don't
right.
take that burden on your shoulder,
Yeah.
not even during COVID, and actually not even without COVID also. Like when you do a surgery, sometimes everything is perfect and you were perfect, and yet the result was not perfect. It does happen sometimes. And sometimes everything was complicated, but the result is so beautiful. There is something more than just you as a doctor, and you have witnessed that regularly. And that what is more is the destiny of that person, and the destiny of that person is that person's destiny and their karma. If somebody has to get a bed now, anything will start happening and they will get a bed from out of nowhere, even if there was nothing, and it will become available for them. And everybody will say, from where did this person get a bed? It was not possible. That person's karma and destiny is making it happen. even if everyone thinks no. And sometimes simple things get complicated. So please don't think that we can write destiny of people. We are only small puppets in this whole drama of the world. We're just little parts. Even God does not write the destiny of people.
Right.
We write our destiny with our karma. We only need to be clear that my conscience, my karma is right. And every day, every night before going to sleep, please do this. Surrender what has happened during the day to God. Please don't go to sleep with it. Over a period of time, that trauma will start getting recorded here. So before you go to sleep, just surrender. Today I did this, I did this, I did this. I was not able to help this person. I tried my best. Cleanse your system before you go to sleep. Cleanse your system and surrender and say thank you for everything that went perfect. Please don't focus only on things which are not going right during the day. It's very important to focus on the things which are going beautiful during the day and say thank you and thank you and thank you. The more you will say thank you and shukriya for everything that's happening perfect, the more perfection will start happening. It's an energy. But the more we focus on this is not happening right, this is not happening right, then more things will not happen right. This is a law. This is how energy works. So focus on everything that's beautiful. Surrender to God before you go to sleep. And that moment when you say a no to somebody, that moment when you have to say a no to somebody, verbally you say a no, and in your mind you say, I tried my best. I tried my best. God bless this soul and let them go forward. Which means God bless this soul means we are sending them with a blessing so that they can go forward into another hospital and get what they never say no what. This recording here is very, 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 very important. Very important.